Medicare Advantage plans are losing their luster with new seniors. And this recent wave of baby boomers, they're not sticking around to figure it out. Switching is up, trust is down, and the noise, it is louder than ever. The new results are in from a recent agent study, and I think they're going to shock you. Hi, I'm Erika Smiley with MedicareSchool.com. I'm one of the educators here, and I'm really just here to show you the smiley side of Medicare and take the stress out of navigating the Medicare maze. In this video, we're going to look at a recent poll that was taken of people turning 65 and aging into Medicare. We'll review the 3 different options you have with Medicare, and then we'll see what these new seniors are doing, which plans are they leaning towards, and what these results should mean to you. There's been a lot of marketing around Advantage plans. Since you're probably watching this video, you're getting close probably to going into Medicare, and you might be getting phone calls or things in the mail. A lot of marketing around Medicare Advantage plans. But these new seniors who are turning 65 coming into Medicare, they're kind of changing their feelings around this because a lot of noise that's been happening. So there's been a lot of bad PR around claims being denied. There's been very public fighting between hospital systems and the Advantage plan carriers. And there's also been a historically disruptive year where we've had 2 million seniors dropped by their old carriers. So these are just a few things that are starting to change the tide about how new seniors are feeling about Advantage plans.
So let's look first at kind of the 3 directions you can go with Medicare. So you can go with original Medicare Part A and B. So now this is, we always said, the worst option, right? If you do anything, don't just stick with Medicare A and B only, because Medicare A and B, even though it's good insurance, it has a lot of gaps. There's 6 gaps, and if you don't have an additional plan with original Medicare, that's going to leave you very susceptible to financial risk. You're going to have a lot of financial responsibility, because a lot of people don't know Medicare, in addition to a lot of the different gaps, it only pays 80%, okay? So that means you would have to pay 20% of everything, and there's no cap on that. So if you have a $300,000, $400,000 bill and you're with original Medicare only, you're going to have to pay 20% of that bill. So really, A and B only is the worst option out of the 3. Now, the other 2 options you have are to go with a Medigap or a supplemental plan. So a lot of you might have heard of like a G plan or an N plan. Those are the Medigap supplemental plans. And with that, we add a standalone Part D drug plan. So you have your prescription coverage. That's one direction you can go. The other direction you can go is to have a Medicare Advantage plan. So the Medicare Advantage plans are sometimes called Part C, Medicare Part C, because it replaces original Medicare. And now you have the private insurance company that is managing your health care. And then this Advantage plan has some perks, and it also has the drug plan included. So usually your prescription drug coverage, your Part D plan, is included in the Advantage plan. Now, there's no right or wrong with a Medigap, a supplement plan, or an Advantage plan. They work very differently. So it's really which one's going to be best for you. So let's look at the results from this year's DEFT study. So this is actually where they polled a lot of different seniors who are aging into Medicare. So they do this every year just to get a pulse on what people are thinking, right? What plans are they going to sign up for? They've been doing this, and we have information on this graph back to 2017. And we're looking at the results from this year, 2025, when we say we're shocked because we're seeing a trend that Medicare Advantage plans are actually losing popularity. So let's look at this graph. We have 3 lines here. One line, the green line, represents people saying, hey, I think I'm going to go with a supplemental plan. So they're probably going to go the route of choosing either a G plan or an N plan, and they're leaning towards supplemental plan. Then we have the blue line, which was representing the Medicare Advantage plans. These are people aging into Medicare, coming into Medicare, who think, hey, I think I'm going to go with an Advantage plan. And then we have a final line down here, the brown line. This is showing people who think, I think I'm just going to stick with original Medicare only. I think I'm just going to go with Part A and Part B. I'm good, right? So let's look at this and some of the different trends. So if we look first at supplemental plans back in 2017 were the highest. They had 45% of seniors, people aging into Medicare, who said, hey, I think I'm going to go the supplemental route. And we see, if you look historically as the years go by, supplemental plans have dropped. They've gone down. We see around year 2021, they went down in the 30% range. And now this year, 29% of people aging into Medicare are saying they're going to go with a supplemental plan. So why might there be a decrease in people saying I'm going to go with the supplemental plan? Well, it could be there have been some increased cost, right? So maybe people can't afford in their monthly budget a supplemental plan. Supplemental plans can be anywhere between $150 to $180 a month. Really depends on where you live in the country. If you're somewhere in the Northeast or maybe out on the West Coast, they might be a little bit more. They're based on if you're male or female and what your age is, but that's the average price, about $150 to $180 a month. So maybe, people's budgets are getting tighter, or they're not wanting to spend that much money, or the supplemental prices are going up. It could also be because of the big marketing push over the last couple years for Advantage plans. There's been so much marketing, talking, people calling you about Advantage plans that might have impacted the number of people saying they're going to go with the supplemental plan. So for 2025, supplemental plans landed at 29% of aging and seniors saying they're going to go that route. Now let's look at Advantage plans. So Advantage plans back in 2017 were around 40% of people, so not too far off from supplemental plans, around 40% of people saying, yeah, I think I'm going to go the Advantage plan route. But we see this spike where the trend really went up, and it really kind of peaked in the years of 2022, 2023, where it went all the way up to 49% of seniors saying, hey, yeah, I'm going to go with an Advantage plan. Well, this really shocked us because there's been a lot of talk about Advantage plans lately, but it actually went down. In 2024, only 47% of people said they're going to go with an Advantage plan. But this year in 2025, this recent study shows this has dropped to 43%. So there's been a 7% decline in the last couple years of people saying they're going to go with an Advantage plan. Now, the thing that really shocks us, and it's actually a little disturbing, are the amount of people who are saying, I'm just going to stick with original Medicare. So that would be Medicare Part A and Part B. And again, Medicare has 6 gaps, right? So you're going to have a lot of financial risk, a lot of financial responsibility. You've got that 20% that you have to pay out of pocket that could be uncapped. There's trillions of dollars of medical debt out there, and the second biggest holder of that are people who enrolled in Medicare. So we don't say sticking with original Medicare is a good decision. That's the worst decision you can make out of the 3 options. But it seems that in 2017, only 15% of people said, I'm just going to stay with original Medicare. But then you see that has gone up and risen, and it's actually quite shocking that 28% of people are saying they're going to stick with original Medicare only. This is really concerning. So we don't know why this is happening. Maybe people are having analysis paralysis, right? They just don't want to make a decision because there's so much information out there about supplemental plans versus Advantage plans. And people, when I talk to them on the phone, they're worried about making a mistake. They don't want to choose the wrong plan. But the worst thing you can do is not fill those gaps and stick with original Medicare only. So let's do a little review. Let's look at Advantage plans versus supplemental plans, because really either one of those, it's going to be a good decision. It's just which one works best for you.
Hey, if you found this video helpful, do us a favor. Go give us a like. We always appreciate it. And subscribe so you don't miss out on any of those future videos. And leave us a comment. We love to hear what you have to say. We love to answer any questions you have. That's what it's here for. So drop us a comment below.
Let's compare some of the main differences between a supplemental plan and a Medicare Advantage plan. So first of all, what providers can you see with these 2 different plans? So can you see any provider? Pretty much yes. With a supplemental plan, you can see any doctor that accepts original Medicare. And that's about 98% of doctors out there. So as long as that doctor accepts original Medicare, they have to also accept your supplemental plan. Now, you can't see any provider with an Advantage plan because you have to worry about networks. So depending on if your Advantage plan is an HMO, a PPO, an HMO POS, you have those networks where if you don't stay in network, you go out of network, you may end up paying more. So you can't just go to any doctor with those Advantage plans. Now, national coverage, a supplemental plan, yes, it's going to give you national coverage because, again, you can go to any doctor that accepts original Medicare. So you can go anywhere in different states. If you're a snowbird and you're in Florida half the year, you can go to the doctor down there. As long as that doctor takes Medicare, they're going to take your supplemental plan. Now, the Advantage plans, no, they're not national coverage. Now, if you are traveling in the U.S. and you have an emergency, it'll cover that. But really, it's a local network. We've even heard stories of people who are on vacation, they fall and break a leg or have an issue, and they say, wait, we're not going to treat you here. You got to go back home to your network of doctors. So if it's not an emergency, you're not going to have that national coverage with an Advantage plan. Lifetime and portability. So is it a lifetime plan? Yes, that supplemental plan, when you get that supplemental plan, the G plan or the N plan, it is yours for life. They can't take it away from you because you're aging, because your health is declining, anything like that. Once you're approved, especially if you have that open enrollment period where you're guaranteed issue that supplemental plan, it is yours for life. And if you move, you can take it with you. Now, again, with the Advantage plans, that's not a lifetime policy, right? Usually you shop these plans. You look at them from year to year because they could change the formularies of what medications are covered. They could change what doctors or hospitals are in or out of network. So we talked about $2 million seniors were dropped by their carriers, right? They switch doctors a lot with who's accepting what Advantage plans. So you need to check these out every year, and they're not portable. If you move from one state to another state, you're going to have to get a local Advantage plan in that new state that you moved to, okay? Now, how about referrals? You do not need referrals. No, you don't need referrals with a supplemental plan. So as long as you have your supplemental card, if you need to go to a cardiologist, a urologist, an orthopedic doctor, you don't need a referral from a primary care doctor. You can schedule directly with that specialist. Now, with the Advantage plans, yes, you're going to have to go through your primary care provider, especially if you have an HMO, and get those referrals to go to those specialists. I know myself, I had to go to an orthopedic doctor. I jacked up my knee, I need knee surgery, and I had to get a referral. It was like 2 weeks later, and I was still waiting for the office to call me. I was like, hey, I have a referral. You're supposed to be calling me and reaching out to me. And it was a very kind of timely process. I had to keep bugging the office to get my appointment. Prior authorizations. So a prior authorization is when a doctor says you need a certain procedure. So let's just say a knee surgery. With a supplemental plan, there are no prior authorizations. You don't have to mess with this. If your doctor says you need a surgery, just schedule the surgery. It's going to happen. So with the Advantage plans, yes, there are prior authorizations. So the insurance company is going to decide if you need that surgery or not. They may say, hey, we don't want you to do that yet. Why don't you go to physical therapy for 3 or 4 months first before we approve this surgery for you? So you do have to deal with those prior authorizations with Advantage plans. Predictable cost. So with the supplemental plans, yes, it is a predictable cost because you know your monthly premium. So again, we talked about monthly premiums could be anywhere between $150 or $180 a month, okay? Somewhere in there, but you know your monthly premium. You know what you're going to pay every month. And beyond that monthly premium, if you do a G plan, the only thing you have to pay out of pocket is the Part B deductible, which this year, that's $257, okay? So your first $257 of your care, you're paying that, and then you're covered for the rest of the year. That Part B deductible is going to reset each year. So it's pretty predictable. You know what your expenses are going to be, okay? Now with the Advantage plans, people are appealed to those because they have a $0 premium, right? So they think, hey, I'm not paying anything each month, but you really don't know what your costs are going to be that calendar year for your medical expenses because you pay as you go. So no, it's not as predictable, right? You're going to have co-pays when you go to the doctor. You're going to have a deductible you have to meet. You're going to have a max out of pocket you could have to pay for the year. So I guess there is the predictability of like if the max out of pocket is $9,000, let's say, for your plan, hey, I might have to pay up to $9,000, but you really don't know because it's more a pay-as-you-go kind of system, okay? $0 premium. Now, this is obviously where the Advantage plan wins out. No, the supplemental plans are not a $0 premium. You do have to pay to have those every month, but you're kind of buying that flexibility and that freedom. You have a little bit more freedom with the supplemental plans. You don't have referrals, no prior authorizations. You can go to any doctor that takes Medicare. The Advantage plans, yeah, most of them are $0 premium. We see a couple where they cost anywhere up to $30 in some states, but for the most part, they're going to be a $0 premium. So that's very attractive to some people. And then lastly, perks. So it was interesting in this study, we looked at that deaf study. One of the top things that was important to seniors aging into Medicare was dental coverage. People cared a lot about dental and vision coverage. So no, you do not get that with a supplemental plan, but it's not a big deal. What we do is we can add a separate standalone dental and vision plan for you. So these are fairly inexpensive. A good dental plan you can get for we have dental plans starting around $25 to $50 a month, depends on the kind of coverage you want. Vision plans start around $10 to $16 a month. Again, depends on the coverage you need. So the supplemental plans do not have the perks with them. You have to get a separate dental or vision or hearing plan. Now, yeah, the Advantage plans, they do have those perks. So the Advantage plans, they come with things like a gym membership, a little bit of a dental benefit, vision benefit, hearing benefit. But a lot of times people don't use these, right? So when we say wherever you choose, whichever direction you decide to go, don't just choose the Advantage plan for the perks, right? Because a lot of people, they get that free gym membership, but then they don't even use it, right? So you really want to make sure you have the best coverage for you. Now, I love, a lot of you have watched our videos. I love our founder, Marvin. He says, neither of these are a bad decision. They're both a better decision than sticking with just original Medicare. And he likes to say supplemental plans, they are exceptional insurance. Over the Advantage plans, those are acceptable insurance, right? Either one of these are going to give you coverage and fill the gaps of Medicare a lot better than just sticking with original Part A and Part B. So it's interesting that this poll talked to seniors who are aging into Medicare this year in 2025, and we're seeing that decline go down in Advantage plans. So what does this really mean? I think it means that seniors are getting smarter about just not taking the shiny bait of a $0 premium and free gym memberships, but they want to know how their insurance is going to work, right? And they also want some freedom and flexibility when it comes to I want to travel. I want to be able to see any doctor. I don't want to have to worry about referrals and prior authorizations. So we just encourage you to really look at all of your options. There is no crystal ball with health, and you really don't know if you're on a good plan until it's time to use it, and you really need that insurance. So whether you go with a supplemental plan or Advantage plan, those are both going to give you better coverage than just original Medicare only. But as always, if you want more information, feel free to give us a call. And if you want to learn more about supplemental and Advantage plans and really dig into the difference, you can watch this video.